Hey guys, Austin Podolsky, Center to Medsales. We have Dr. Hardwick in the studio testing the infamous Inmode Morpheus 8. Doc, how are you feeling? What do you think about the treatment so far?
Really tolerable, just a tiny bit uncomfortable. I put some local anesthetic cream on about 30 minutes ago. Maybe feels like a little mosquito bite, but I'm absolutely fine.
How's the heat?
I really can't perceive that it's hot actually with that local cream. Very tolerable. I've had laser procedures done and other things that hurt a lot more than this. Botox hurts more than this.
And Brianna, are we doing her full abdominal today?
Yes, so we're gonna do her full abdomen. We're actually gonna focus on a deeper depth on this area, and then we're gonna focus on a lighter depth so we can focus on tightening some of that skin on her lower abdomen.
So I have 3 kids and I'm pretty slim, but my skin didn't go back to how it was before I had kids. So this is awesome for that kind of thing, or for patients who've lost weight. Amazing, or liposuction, or especially if we're a little bit older, your skin doesn't retract. So I had my kids at 35 and 37. My skin did not shrink back to how it was before.
Naturally.
Right, so I do sit-ups all day long, my skin is not gonna shrink. So this is an alternative to having a surgical skin tightening procedure. You know, I could have had a tummy tuck or something, a much bigger procedure, but this is a much easier way to do that. Now, no downtime really. I'm gonna be walking out of here and could go back to normal activities, so pretty amazing.
Quick question for both of you. We're using the standard Morpheus handpiece right now, right?
Mm-hmm.
Which has a 4mm depth.
Yes.
Do you feel like there is a need to have deeper depth?
This is 4mm, and my Morpheus does have products that go even deeper. There'd be rare patients who might benefit from something deeper, but they're probably going to be looking at having some type of surgical procedure instead, honestly. In my opinion, if they need something deeper than this, it might be more appropriate to get an abdominoplasty or something else instead.
Absolutely. So comfy, happy?
Yeah.
10 out of 10, do it again?
Yeah, I can't wait to do it again.
How long is she gonna wait, 6 weeks?
No, you can actually do this treatment about 4 weeks. So every month or so is when you can have your treatment done.
And how many sessions do you think for a typical patient, BMI, 25 or under?
So for most of my
24 or under?
patients, I do a series of 3. That's where I feel like I bring them back to a foundation of, okay, this is the result that we have. If there's anything that we need to work on further, we can kind of figure that out after their series of 3. Post-care is super easy. It's very no downtime. So I like to tell people just treat it as if you went out and you had an actual procedure done, because these channels are open for up to 36 hours after. So it's very important that you're not exposing yourself to a lot of heat, you're not exposing yourself to any bacteria, and you're not exposing yourself to anything that could cause any contraindication to the treatment. So you want to keep it dry, keep it clean for the first 1 to 3 days. If you're using a growth factor or a healing ointment that's non-petroleum based, that's great as well. And then after those days, about day 4, you can start to return to your normal routine.
Awesome. Still comfy?
Yeah,
Okay.
it's fine. And there's some fun things that you can do after this, like using platelet-rich plasma or other growth factors to stimulate the healing to be even faster. So lots of different ways we can play with this to maximize the results for different patients, which is really cool.
And so many treatment areas, right?
Yes.
Yeah.
Face, neck, décolleté, hands, abdomen. I think you're treating another area today as well?
I told Brianna we could just start at the top and go down to my toes.